Joining us now on USCAP TV, Dr. Jeff Myers, the incoming USCAP President. Thank you so much for taking some time out of your busy schedule today to chat with us. Your official start is in April, so you've still got a little bit of time left, but what are you looking forward to? What kind of goals do you see for this upcoming year?
We've got a lot of exciting ideas coming from a number of our groups, and I think figuring out how to make sure we have the infrastructure and the bandwidth to bring those to market is a key goal of mine this year.
What are the biggest challenges facing pathologists right now?
Wow, there are so many. I think the easy target, I suppose, is reimbursement in the changing landscape in terms of understanding how we can still get the sort of margins we need to sustain all of our missions, not just clinical care, but education, which is key in any medical center, whether academic or otherwise. Research enterprises in terms of academic medical centers, it's less and less clear what the business model of the future will be that allows us to survive the changes in reimbursement. I think beyond that, continuing to identify the best and the brightest and recruiting them to our discipline, helping them understand what the future is, given that none of us can see it quite clearly, is a challenge for all of us. I think in addition to those things, pathology has to rethink its role as the fee-for-service model fades. Understanding how we add unique value to care is a strategic challenge. And I think some of that will require thinking very differently about how we interact directly with patients as opposed to interacting solely with providers. So I think it's an exciting time for pathology. I think in many respects it's never been better, but it's a little uncomfortable because change isn't easy.
And you talked about reimbursement, healthcare reform, and changes in the law. Of course, something that's been talked about at length over the last couple of years. Is that a major issue being discussed within the world of pathology right now?
Absolutely. On Saturday, nearly the entire program for an organization known as the Association of Directors of Anatomic and Surgical Pathology, abbreviated ADASP, was devoted to exactly that topic. We're very concerned about how we will continue to sustain our missions that I mentioned previously. For example, with cuts in the NIH budget, it's very unclear how clinician scientists will continue to be successful, and that's absolutely essential to maintaining the sort of cutting-edge medical care that North America has become accustomed to. It really leads the world in that regard. And it isn't at all clear how we're going to continue to be able to do that. Dollars for education are shrinking, and how we're going to prepare the next generation to care for us is not clear. So it's a very hot topic, one that I think most view with some degree of trepidation and fear, but in that there's opportunity, and I think it's linked to some of the other changes that I mentioned. I don't think that we'll be successful doing pathology as we've always done pathology, and that's actually exciting, I think.
So the biggest worry is money?
The biggest worry is money, I would say. That's my biggest worry.
And so you are about to take over as USCAP President. Have you had a chance to speak with past presidents to get their take on what some of the biggest challenges are that they faced, or any words of wisdom?
I've talked to several of our past presidents, and they have a lot of insights and experiences. I'm not sure I've probed them as deeply as I need to, but I think some of the challenges that they've confronted remain. I think we'll have some that they've not yet had to confront. So yes, I know them and I've talked to them, and I no doubt will continue talking to them in the year ahead.
All right, Dr. Jeff Myers, incoming USCAP President, thank you so much for talking with us today.
My pleasure.